So this is the first of 5 series webinar that we've put together on maintenance and natural remedy for elite athletes. So each webinar will focus on a different part of the body, and we chose hips because given Garnet's experience with athletes, hips are one of the most parts of the body which athletes, especially Muay Thai athletes, have most trouble with. And then we'll also include a different topic in nutrition in this series. So a little bit of history between Garnet and I. He's been my massage therapist ever since I first started my amateur career. So we've developed a really good relationship, and I just wanted to highlight and underline the importance of finding somebody who you can trust, who knows your body, who knows your training regimen, and that they can guide you in the right direction whenever you have injury or discomfort. So Garnet, do you want to take it away on a little bit of background about yourself?
Sure. Looking at all these, as it was listed down on this thing, there's a lot of education in this thing. Anyways, so what Janice has said earlier, I've been working with the Thai boxing industry for over, I would say, 15 plus years. Myself, I've been training under a local crew here named Krudar from 2004 in and out here and there in terms of training, and I've really stayed in contact with the Thai boxing, at least here in Toronto, Ontario, fighters in particular. And Janice was definitely integral in terms of building awareness, in terms of having a therapist with you go along the way, and seeing all the fighters over the years just either develop into elite condition levels to even
Hello?
or hitting something too hard. So I've seen it all, from broken bones to sprained ankles and all that stuff. Been able to kind of get to that point of at least being part of the recovery process. Aside from that, I work with other things in terms of concussions and working with the bones in particular. That's called matrix repatterning that I do. It's a lot easier for people to know, like massage therapy or personal training, but I do a specialization in trying to repattern the body through a method which is called matrix repatterning. And I can go on and on about all the qualifications, but ultimately I'm here to essentially just give you guys out there a bit of idea of how to at least kind of figure out, in this case, how your hip either works and what to do when it does hurt. So I'm going to move on to the next presentation we have, and just giving you guys a move down the whole view. So start here. And if you guys have any questions about all of this, please don't be put it on the chat, and we'll answer any of the questions later on. So for now, we'll just go through the list here, or some of the information, and then we can go from there afterwards to give you guys any insights afterwards at the end of the presentation. So here we go. So 4 easy steps to unlock the hips for elite athletes. All right. So moreliving.com is, by the way, just a clinic that I own and operate here in Toronto, and we do massage therapy, physiotherapy, kinesiology, which is study of movements and whatnot, and some training involved with it. And we work with local doctors as well as international ones now to essentially create programs for injury, either pre or post injury for people. So we're located in Toronto, Ontario. All right. So let's look at the hips for a minute here. If anyone has ever seen what an actual hip looks like, they look like, I always want to explain like how a hip kind of works, and it's a ball and socket type of foundation, in which the femur or the leg bone, the parts that you guys often try to kick on the side there, basically goes into the pelvis pelvis itself. And what I want to kind of highlight with regard to the hips is that we often kind of look at this in terms of muscles, or it hurts here and so on and so forth. But I just wanted to kind of explain a little bit what's going on with the hip. And it's actually 3 joints. I don't know if you guys can see my cursor as I'm kind of going around it. Hopefully you guys could. But you have the sacrum, which is this kind of bone here, and I often feel it as a tailbone. And then you have basically the sides, which is called the ilium, so left and right. And just the importance on that, for anyone that does, you don't need to know anatomy in terms of all that stuff, but just know that basically there's joints in between the sacrum and the ilium. So here, so you'll have a little notch in the back of your back. That's basically where the ilium, or this bone here, goes into the sacrum, which is the middle part. And then going into this part here, and then there's the groin area, where sometimes you guys, if you either, for guys, a little bit more constant with regards to groin pain. For the most parts, with regards to groin pain, it's usually called, it's this part here, which is called the pubic symphysis, which essentially has once again attachment points that get stretched out over time. So flexibility is good, but over flexibility isn't, because you have instability that happens. So that's in a nutshell how the hip kind of looks like, and I'll go through some other screens here for you to show you a little bit more what's going on. So in terms of movements, for Thai boxers out there, or anyone that's in athleticism, it's responsible for walking, running, and jumping. So I often would tell people, or like the way my understanding of the body is, that there are 3 springs in the body, and the hip is one of them. So it's responsible for, when you're jumping, that it takes on the impact in that particular area. And it's really important in terms of the positioning of it, because of the fact that the spine sits right on top of it. So really important in terms of being able to move the hip as fluid as possible, and to essentially test those things. So for you guys, and it really depends on your training, there's a beginning part in which you guys do a lot of rotations for the wrists, for the elbows, and so on and so forth. To me, I look at that as a form of assessment and movement. And that's essentially what I'm going to be trying to explain to you guys a little bit more about the 4-step methods, in terms of at least what I've seen over the years, and at least how to go about finding out what's going on with your body. And like what Janice said earlier, obviously there is importance to be able to work with somebody that knows the body, that you can trust, that they can guide you a little bit more on what it is. Because at the end of the day, like, I mean, even in my kind of position, I can say that it's this, but there's something about someone else being able to be like, actually, this is a little bit off. So, I mean, like a good coach or trainer, they'll spot what you're doing a little bit off, and they may not necessarily know what's wrong with it, but there is something off. And that's kind of where, in terms of body work, kind of sits in. You want to at least kind of pick up on the bigger picture. But for the sake of keeping it in the hip, I'll more what's going on with the hip pain here, or hip kind of movements. So the most important thing I would say is to make sure that things are set in the right direction, or right movement. So the spine itself is really important in terms of gravity. So if you have, for Thai boxing, what is that you tend to go in that C shape, and essentially it's not necessarily the greatest for the spine. I understand it in terms of stance and being able to kind of position yourself, but you want to make sure in the off times for training that you're trying to get your spine to go back to where it used to be. So there's a natural curvature that happens with the spine that we have to respect, because over the years, what ends up happening is that you end up either injuring a part of your body that may not necessarily be related directly to that area, like hip pain, but it could be because of, say, your lower back is too flat, or your upper back is too curved. So there's all these factors that comes into play when, at least for anyone coming in to see us, or when we're assessing to see if all these other parts comes is a factor to why you have hip pain. So here's an example of certain positioning. So for I think of the sway back as if there's a foot coming towards your face and you want to move away from it. Lumbar lordosis is kind of like trying to taunt that person to basically try to hit you. thoracic kyphosis. I think of that as Sanchai, as basically trying to put his face in front, and as on so on and so forth. But what we want to pay attention to is basically the last one, which is how it's called the plumb line, in which there's a straight line, which is gravity, that hits from the top of our head that goes all the way down towards your feet. So the beauty about physics or gravity is that it's truth. It's up and down. So in essence, you want to make sure that your head is on top of your ears, or at least your shoulders, sorry. Your ears should be lined up with your shoulders, to your hips, to your knees, to your ankle, essentially. And that will at least lessen the amount of stress in your spine. So you always want to try to get the curvature that is happening at the neck and the back. So that's just kind of like what good posture looks like. So here's an example of how to basically neutralize your spine. So there's a practitioner named Pete Egoscu that basically has created some methods and movements that allows you to essentially let gravity fix you. So in this situation, what this person is trying to do is to actually loosen up the hips. How so? Is that basically in this position, he is lying flat on the back, which allows a lot of the bones to set in downwards, in which neutralizes anything that, let's say, if your spine is a little bit more forward, they'll kind of sink down a little bit. With his feet being up here, what he's trying to get to is to loosen up the muscles in the hips on the right side here, and at the same time, the groin area. So there's positioning that you can do to allow gravity be your therapist, in essence, to make sure that your spine is, first of all, neutral before you do anything. So like anything else, you want to start off right, or you'll pay for it later on, either an injury where your body is not responsive enough to adapt to change. So for you guys out there, if you guys are suffering some lower back issues as well, this is a really good one in terms of staying put in this position. And the prescription for this is about 20 minutes lying flat on your back in this position. There's angles on this and how you can perform the set of methods. So that's one of the ways to basically neutralize the spine. The other one is by this doctor named Stuart McGill, in which what this does is to essentially neutralize the neck in particular. So a lot of the things that we see now, for you guys especially, for all of us being on the computers, that we tend to kind of get into that neck forward position. So in this case, what this image is showing is that this person actually has her teeth kind of clench a little bit, just stacked. Her tongue is on the top of her mouth, and she's pressing into her knuckles, and her knuckles is pressing into her chin. So what that does is that it activates the back muscles and the neck muscles, the deep muscles in the neck, which essentially just sets the head back into position. So Stuart McGill, by the way, for you guys out there internationally, he's a kind of a famous doctor here in Canada. He actually lives he's from Ontario, and has been giving a lot of these talks and conversations with regards to spine health. So definitely important to basically look at your spine first before you kind of move on to the next thing. And in a workshop that we'll be doing in the future is essentially being able to at least get some of these concepts, these ideas, to at least try to see what we can do first before you move on to it. So think of neutralizing your spine as like a warm-up, right? You want to get just a little bit hot enough or heated enough so that you can actually start pressing a little bit harder in terms of your training. All right. The next one is really key in terms of the body for you guys in particular. For Thai boxers, I found that like there is some weaknesses that I saw through hundreds of Thai boxers that I've seen over the years, and athletes. Well, Thai boxers specifically, but I'll go into that a little bit more later. But this one right here is a side plank that you guys probably all know about. And once again, this is to help neutralize a bit of the spine. It's more dealing with the sides of the body. And in this case, what this person is trying to engage is, there's two things happening here. You have the abdominal muscles, the thoracic abdominal muscles on the side here, but essentially it's called an isometric hold, which you're not doing anything. Nothing is moving at all. You're just holding it. So for you guys that have done the planks for long periods of time, That's basically the same concept here, but there's more advanced methods in this and how this person is doing it, of having lines here being activated as this person is doing a plank. So those three things that I just kind of posted are there to at least neutralize your spine a little bit more before you start. And for ideally, obviously, this is done in the morning. The first one was for 20 minutes. The next one was for about 2 minutes, and this one is about roughly 2 minutes on each side, if you could do it. I'm sure you guys could do it as athletes, but you just want to make sure that things are neutral before you go ahead and start training. All right, so the beginning of this, in terms of the 4 easy steps to unlock the hips, is the first one I want to start off is for anyone out there that has pain, where is it? So where are you feeling it? So the next part of this is to at least give you an idea in terms of the areas on where potentially can be. All right, so in this diagram here, or these diagrams in particular, we're I'm showing you at least deeper muscles of the hip. So for you guys out there, you probably already know what the hip flexors are, right? The name for it is called iliopsoas, and all that means is that these muscles by the spine, called the psoas, goes into the femur, which is the leg bone here. And then you have iliacus, which is the inside part of the pelvis that goes once again into the femur itself. So as you guys can see, it's called iliopsoas because it's together. It does almost the same movement, but the difference here is that you have one going from the spine and the other one going from the hip. So the majority of individuals out there, they're often feeling this part of it in terms of your hip muscles being tight. So tight hips, like where does it hurt, you know? But the interesting thing about this muscle is that you can feel this all the way around the back as well too. The next one here is basically your glutes, the ones that you guys are doing all the squats for, all the hill training, all the knees and teeps and everything else that you guys do. Oftentimes you do develop a good, strong derriere. But the thing is, no pun intended on the butt part, is that this is a very big muscle, and all of these muscles are pretty big. And the thing is that these muscles end up taking over a lot of the times because of just broad, big movements. But what we want to really pay attention to are these ones right here. So these muscles here are the ones that are responsible for turning your hip and also stabilizing your hip. When these muscles start to fall, kind of like on the weight side, weaken, shorten, tighten up, that's when you start feeling the pain. So it just throws off your mechanism as a body in terms of your hip. So this is a healthy body right here that we're seeing. In sports, obviously, where there is like trauma involved in terms of hitting one another, well, guess what? These areas could be easily offsetted, and if you have an injury that was already there, or even a tiny injury before that, it's just going to get blown up. So over the years, I've realized that in terms of Thai boxers in particular, and I know this is a generalized statement, but what I saw a lot of the times is that this muscle here called glute med that goes from the top of the hip towards the leg bone here is the one that's responsible for essentially going lateral or sideways. So the side plank I showed you earlier was there to activate some of those muscles, but I found like this muscle here is pretty weak. So if I was to do a muscle test, and all it is essentially lying on your back and then just kind of testing you out in terms of bringing your leg inwards and you're pushing outwards, it's like an arm wrestling match for me. I'll win all the time because these muscles here are often not being used in this sport in particular. And I've seen in other things as well too that doesn't require a lot of side-to-side movements. And at least in Thai boxing, from what I've learned over the years, that a lot of it is definitely attack or back, a little bit of pivot here and there, but you don't really spend a lot of time going sideways. So that's something that you definitely want to look at in strengthening, just for preventative, as you guys continue with your training. All right. So the motions of the hip, or at least in this case, like where is it hurting, is that basically the front, the sides, the back, and rotation. So these are just kind of like the names from how we kind of describe it in our field, but essentially is it hurting in the front? So if you guys have hip pain or now, feel it. Are you feeling in the front of the hip where I showed you guys the muscle? Are you guys feeling the side of it? Are you feeling in the back of it? are you feeling it when you're turning your leg in and out? Okay, so you want to distinguish which one is which. So when you are looking at the front, you're looking at it from the hip flexors. The one I showed you guys that goes from the spine all the way to the leg bone. If you're feeling in the sides, remember those little tiny muscles I was showing you to stabilize the body? Well, it's that one right there. And if it's in the back, it's most of the time it's like either more ligament. One of the slides that I showed you was there's tiny little ligaments that are actually holding the hip in place, and those things can be aggravated. And if those are aggravated, it's going to cause pain. It's going to throw off the mechanism of the hip. And then rotation is essentially what once again, going back to those tiny muscles in terms of how it turns in and out. And a lot of this is like if the joint itself, if you kind of look at the video screen here, like the hip is like basically a socket. So imagine this is the leg bone going into it. So what it does is it actually just kind of moves around in this way, right? When you guys are saying doing a front kick, all it's doing is doing this, back, or at least swing kick, it's doing this. So it's like an elbow. It's very similar to the elbow. Elbows or elbows, shoulders and hips. So essentially when you're doing any type of rotation, you can grind into that space if the mechanism is off. So once again, going back to neutralizing your spine before you train, which is important, is key to make sure that you guys aren't over kind of irritating a space already that is tight. So these are the movements generally how the hip works, right? So you guys have probably done this in the past. So taking the leg away from the body, bringing the leg towards the body or the feet. You guys know this one because essentially it's a front kick, or it could be a teep, it could be just making swing kick, and then bringing it backwards. So these are some of the motions that basically your hip can do. All right, so when does it hurt for you in terms of this? Does it hurt in the morning when you wake up? Does it hurt when you move? Does it hurt when you're sitting? These are questions that I would ask somebody when they're coming in, because essentially if it's hurting when you're just sitting there, it could be other things. It could be things like arthritis. It could be a strain in the actual area itself. It could be nerve related. Does it hurt when you're moving? Well, is it pulling on the muscle? If it's a muscle tear, then it's going to hurt. There's ways of trying to figure out what it is, but you have to figure out, like, you have to understand in terms of, okay, when does it hurt? Does it hurt more in the morning? Does it hurt more at nighttime? Figure it out when it does hurt, and there's ways of at least attacking that when it actually hurts. And these are just some of the movements that you guys can test out. So the ones that I showed you guys earlier in terms of the motion of the hip is to see when it does hurt, just to identify which muscle is actually either aggravated or which joint is aggravated. So just more of that in terms of how to do this. And this is, I mean, you guys, in particular as Thai boxer, you guys know a lot of these movements already, but I would check it out first, one side versus the other side. I would compare it to see the quality of the movement. And that's a good way of trying to understand of, like, okay, later on to the next slide here on how to test the muscles in particular. So the one thing that so moving on to the next thing here. So once, like anything else in terms of training, you want to find your weakness, and the body itself also will give you signs and symptoms of what is weak. And in muscle, weakness is essentially the area itself tightening up or shortening. So when you have an area that's shortened, you now have big muscles like your glutes that will take over, and the front of your hips that will take over, that will do everything for you. So doing those angles that I showed you guys in terms of when does it feel either like painful, and being able to test those areas in terms of range of motion or movement of the leg or the hip will give you a little bit more in terms of, like, okay, I can't really go that high with this one. What's going on here? Do I have to stretch it or do I have to strengthen it? And most of the times you want to do both. You just want to make sure that you are essentially doing it consistently enough so that at least the left equals the right. You're always looking for symmetry in the body. And the thing is, like any fighter that I've come across, you tend to be dominant on one side or versus the other. And I know that's important in terms of either you're better on this side versus the other side. But you have to look at this as well as not being complacent at being good at one thing. The nervous system, your body, is always looking for balance. The more balanced you are, the less prone to you are for injuries. So what does that mean? Well, change your stance. I'm not a coach in terms of this field. I am an athletic coach more than anything else. But find your weakness, find your imbalance, because essentially, once you start working on the weaker areas of your body and get it to a level in which if you're a 2 at that skill setting, you get to a 6. Well, 6 is better than 2, obviously, but I know it's not like, elite level, but that 6 will transfer the work that is being done on the one side of your body to that part of it. So essentially, you're actually just like making the almost like the whole body stronger because of it. So as you kind of work at these little kind of flaws in terms of movement, your game also improves because of it. There's a correlation with regards to how you feel in terms of how your mindset is. So if you're feeling like I'm sore, I'm in pain, and so on and so forth, I mean, I'm not a psychologist, I'm not trying to play one, but the mental part in this is so key in terms of being able to not necessarily go through the pain all the time. I know you guys could take a lot of pain, but finding out what is causing the problem, the root cause of it, and working at it. And like anything else in terms of all of this stuff, it does take time. Similar to you guys that are out there fighting or performing or competing, I'm sure you guys weren't that good right away, unless you were like the Bruce Lee in your field or whatever it is. But it takes time. And the same with this, it's not like poof, you're fixed, magic fingers, you're done. It's not how it works. Basically, your body has to absorb this. You have to eat this. You have to be this. Similar to the discipline that you guys have as fighters. Find your weakness and work at it. Work at it, work at it, work at it, work at it, to the point that basically you're not even thinking about it anymore. But you do have to start off with, okay, what can I improve on, right? And this is the same way in terms of how you guys are getting better in either your kicks, punches, or your game in particular. Find your weakness in your body. So just once again, going back to testing your movements, the same thing that I did. That's what I would do. Just test it out. See what you're weak at or not strong at. If you're like, say, a single leg, like this motion right here of internal rotation and external rotation, are you guys kind of going off balance with regards to this stuff? Right. So I know a lot of you guys can stand on one leg and kick at the same time. I would test those muscles out a little bit more, because there's just something about how your feet relates with their hips when you're doing something, and it will improve at least your capability to not be injured throughout your training career. All right, so once again, like what I said, told you guys earlier, just make it stronger. Find the weakness, go at it. In terms of, I'll leave it up for the coaches in particular, but essentially you either want to measure it. If you can't measure it, you can't track it. So you want to either log these things in terms of either, time or repetition, and you want to do it consistently enough. It takes about 8 weeks for your body to adapt to anything. So you want to at least do this in a way. Week 1, okay, I'm going to work on this area here 3 or 4 times a day, 3 or 4 times in a week, add it to your regimen in terms of your kind of rehab or your kind of like rest and recover days, and see how you improve. So say if you're holding a side plank for 30 seconds and that's all you can do at the time, see what happens. Okay, 45 seconds, good. 90 seconds. Build up to it. But don't forget this in terms as you move forward, because these are going to be your tool kit for your body, right? And every single body is different, and everyone has a method to how to fix it, but you yourself have to be an active person in terms of healing your body throughout all of this. You really have to advocate for your own health, which is kind of the essence of what we're doing, right, Janice? In terms of all this, is to advocate for your own health, right? So we're here to facilitate or help you guys be able to at least in your time to look at these things a little bit differently. And I know there's a lot of noise out there on what's out there, how to do this, like drink more protein powder, whatever it is that's out there. But we're just going as simple as possible, finding out what's not working for you. And then the next part of this which is Janice's going to be forte. She's going to be talking about how to basically become less inflamed and all these things. Let me see if I missed out anything else. So here you go again, guys, a little bit of a better picture just to kind of give you guys a bit more insight to it. So making things stronger, I would say for a lot of athletes in Thai boxing, you want to make sure that this glute med right here is strong. Okay, the responsibility of this muscle here is so key in keeping your stabilized a little bit more. And if you guys know what the IT band is, that's what it attaches to. So it actually keeps the knee from buckling, right? So all the kicks that you guys are getting on the sides of your leg, guess what gets traumatized? That muscle too. The bone itself, the femur itself, also has its own kind of specialty, and I'll go into that later on. But for now, I would say strengthen your glute med for you guys out there. This one right here, the piriformis, if anyone's ever had any numbness and tingling down the leg, this is a hard one because essentially what ends up happening is that this muscle becomes overly aggravated, and there's a nerve that goes down behind it that gets pressed on. It's called the sciatic nerve. And when that tightens up, that gives you shooting pains or numbness and tingling down the leg. And that also just, to me as a practitioner, when I hear about piriformis pain, there's either something happening in the spine up above. So once again, neutralizing your spine. See, goes hand in hand. If your spine is not great, it's going to cause problems below, right? So you will always want to look at it from above and below the area that is a problem, because it's usually not just that one area. So there's ways to also how to release these pressures here, which we can go into the next time as well too. So I think that is the end of my presentation, and I'm gonna pass it on to you, Jay. Hopefully you guys, if you have any questions about all this, once again, send us a message on this thing. Take it away, Jay. Your turn.
Okay, thank you, Garnet. That was really informative. I learned a lot about different parts in my hips. So thank you once again. So I'm going to be covering the nutrition portion, and I have a background in holistic nutrition. So it's not just about what to eat, but how to keep your mental, your physical, and your spiritual balanced. So I'm going to go through, I was thinking of things that I could speak about, and I thought inflammation was a perfect one because oftentimes as Muay Thai athletes, we experience a lot of inflammation. So I just want to give you as much information as possible so that you can maintain a good training regimen and experience as little inflammation as possible. Okay. So I'm going to go through 4 easy steps on how to reduce inflammation. So we're going to go through controlling blood sugar, reducing stress, reducing or eliminating inflammatory foods, and how to load up on anti-inflammatory food. The first one, how to control blood sugar. So how does sugar cause inflammation? So when protein are combined with sugar in our blood, they create these advanced glycation products called phages, which when they accumulate in excess, they cause inflammation. When we have too much sugar, our gut becomes more permeable, which increases the chance of bacteria and other inflammatory products to enter the blood. So this can create allergic reactions, which also creates increased inflammation. Sugar and other inflammatory foods cause LDL, so the bad cholesterol, to rise, and this causes an increase in C-reactive protein in your blood. And this is also known to cause increased inflammation. Excess sugar leads to weight gain and increased body fat, and this can also lead to inflammation as well. So how do we control blood sugar? So you have to identify the foods that can increase your blood sugar. So refined sugar, of course, brown sugar, artificial sweeteners, white flours, breads, pastas, baked goods, candies, chocolate, pop, and sugar sweetened juice. Step 2, reduce stress. So stress causes inflammation in the body. So how do you reduce your stress? Make sure that you get good rest. Through resting, your body is able to recover, and it's able to get rid of the toxins in your body that have been accumulating throughout the day. So it's really important that you get rest, especially as elite athletes, because you're working your body so hard. Remove stressors. So whether it be stress in the workplace, in your own personal life, you want to make sure that you have as little stress as possible so your body can flow a little bit easier. Spend time in Mother Nature. So I know it's really difficult during these times because we're trapped inside, but spending time in Mother Nature not only allows you to get some natural vitamin D from the sun, which helps to increase your immune system, but it also allows you to ground yourself. So by grounding, it sounds kind of weird, but if you allow your feet to touch soil, or if like you sit under a tree and you meditate, it allows your body to kind of be at the same energy level as the earth. And the earth is where we come from. So as much as it sounds kind of out there, it really allows your body to relax and kind of regain composure. Meditation. Meditation is great to clear your mind. A lot of times I hear from clients or even like teammates that they think a lot, especially before a fight. I think the more clutter you have in your brain, the harder it is for you to function optimally. So getting to know how to meditate properly will really help you. Finally, have me time. You know, as Muay Thai athletes, we can have a job, we have school, and then we have like this rigorous training schedule. But you really need to spend a little bit of time doing what you enjoy, so you can kind of reignite your passion and keep that passion protected. Okay, so you want to eliminate inflammatory foods. So you should avoid these foods, which I've already kind of mentioned with respect to the sugary foods, such as white flours, breads, pasta, white and brown sugar, artificial sweeteners, nightshade vegetables. So sometimes people are very sensitive to nightshade vegetables because they produce a chemical called solanine, which is said to increase inflammation in the body. So be careful. Sometimes you have to kind of play around with the food that you eat. Remove nightshade vegetables for 1 week and see how you feel. And if you feel better, maybe you're a little bit sensitive to those vegetables. Conventionally raised beef and pork, keep portions to 1 to 2 portions per week. So these types of meat, they're either fed with a lot of unclean food, and so this creates a lot of, it makes the meat fattier, and this is worse for your body because your body has to process a lot of unclean products in the meat. You can eat beef or pork that is either grass-fed.
With regards to that, grass-fed is definitely a little bit better in terms of eating because of here in North America, there's actually a lot of our foods that are being fed like the same, like there's hormones that are being put into a lot of these animals as well. So you are what you eat. Even in particular, I'm learning so much about nightshade. I'm like, what are nightshades, by the way? But yeah, you're right about that, Janice, in terms of a lot of these things. If you can eat local is one of the things that we try to basically do here. And know your butcher, know your farmer is one of the things that's also great about living in a place where if you can, find out a little bit more where your food comes from, there's ethical portions of it, of doing that. But there's also, a lot of these athletes that I also treat, definitely are on top of their game for what you're talking about right here. Like they all, like every elite athlete that I worked on has this part of it like down packed. So what you're seeing here is really important to continue the drive to become that level, because in a sense your body is a temple. So that's kind of what I'm learning from all of this. So
For sure. So we're gonna go to pistachios, cashews, and peanuts. So these particular nuts, they often have fungus in them, which can create inflammation. So you want to be careful. So again, just pay attention to things or how you feel after you eat. And if you feel, or if you have a feeling that something may be causing it, take it away for like a week, 2 weeks, and then reintroduce it and see how you feel again.
want to hear
Margarine
something cool about this?
Sure.
Sorry, Jen, to interrupt you, but there's a hack here in terms of, and I'm not a doctor, but if you eat something that is not good for your system, your heart rate actually increases by about 10 or 20 beats per minute. So your resting heart rate maybe should be sitting about 60 beats per minute. Even if you're an athlete, you actually want to keep that. But as soon as you put food in your system, to check your pulse, like right here, and just count for a minute. And if you're irritated in that area, it gives you that sensitivity that Janice is talking about. Sorry to interrupt, Janice, but I just wanted to put it in there.
That's amazing. All the more information, the better.
Yeah.
Okay, margarine shortening and commercial salad dressing. These often contain trans fats. Trans fats are bad for your system because trans fats are man-made. So when your system kind of takes in trans fats, it doesn't know what to do because your system doesn't recognize it. So it will store it so that it can deal with it at another time, or it will create inflammation in your body, which can lead to atherosclerosis and other things. Fried foods, so avoid those and choose more baked, boiled, or poached or stir-fried methods instead. Spices from the nightshade family that include cayenne and paprika. So other nightshade vegetables include things like eggplants, peppers, sweet peppers, and you can also look it up if you want to learn a little bit more about what types of vegetables are considered nightshade vegetables. Coffee, alcohol, pop, sugar, sweetened juice as well. So try to avoid these foods as much as possible if you're experiencing a lot of inflammation. So what should you load up on? So choose these types of foods. So fruits and vegetables, so eat at least 5 servings per day or more. You want to choose really deep green, really colorful vegetables because they're a sign of a lot of antioxidants, a lot of vitamins, a lot of minerals that your body needs to combat inflammation or to keep inflammation at bay. Good fats and oils. So good fats and oils such as avocado, fatty fish, olive oil, nuts, seeds. They have omega-3 fatty acids, which keep the membranes in your cells very fluid. So things like trans fats and saturated fats, they make your cells really rigid. So there's no communication going in and out. So there's no good things coming in and there's no toxins coming out. So that's how bad fats create a lot of inflammation in your system. Protein sources, so choose more poultry, fish, seafood, and lean meats, preferably grass-fed. Herbs, so herbs like turmeric, ginger, garlic, they're all anti-inflammatory herbs that are wonderful for the system. They also increase your immune system, so it's really especially good during these times. Beverages, green tea has a lot of antioxidants, also herbal teas. There's this wonderful tea called Tulsi. It's made out of holy basil, and it's really great for decreasing stress, and it really improves your energy as well. So a lot of people don't know that there's an emotional connection to pain. And there's an emotional connection to pain, disease. And so if you think about it, I'm going to go to the next slide. Okay. In order to succeed, we must first believe that we can. So you may have experienced in your own experience people that may have disease or people that may be suffering from some emotional pain, but they don't want to be helped. So this is kind of the same way of thinking of this. Injury, or if you think about pain, oftentimes this emotion has been going on for a long time, or this problem has been going on for a long time. So it takes a toll on the body. So to become whole and healthy, we must balance the body, mind, and spirit. We need to take good care of our bodies. We need to have a positive mental attitude about ourselves and about life. We need to have a strong spiritual connection. When these three things are balanced, we can rejoice in living. No doctor or health practitioner can give us this unless we choose to take part in our own healing process. So this is the importance of being positive. I think what's helped me throughout my entire career is that I always try to look at the positive side of the coin, and that's helped me to move forward, and that's given me the drive to keep moving and to succeed. So with respect to hip problems and inflammation, there is an emotional connection. So the symptom is only an outer effect. We must go within to dissolve the mental cause. So with respect to hip problems, so I've kind of divided it into things that are areas such as the hip problem or hip, the right side of the body, the left side of the body, and inflammation, the probable emotional cause. And in order to kind of fix that emotional cause, or we have to have a new thought pattern in order to, like looking at the positive side, to help fix that area. Okay, so we're going to go through the hip problems. So if you have any kind of hip problems, you may be experiencing, I'm not saying you will or you are, you may be experiencing a fear of going forward in major decisions and nothing to move forward to. So a lot of these times when I have my clients, more often than not, they can resonate with these probable causes. It's really interesting. The new thought pattern to have is, I am in perfect balance. I move forward in life with ease and joy at every age. So what I like to tell my clients is, in order to change this new pattern, you kind of have to, if you don't believe it at first, the idea is to keep repeating it, and eventually it's going to stick, and eventually you might believe it. So the idea is to start in the present and to move forward from there. So oftentimes people can have right or left side, or right side of the body or left side of the body can experience more pain or injury. So this is really interesting. So on the right side, the probable cause is giving too much, letting go, and it's involved with the masculine energy, so the father. So if you are in a family unit where, I don't know, you don't have a good relationship with your father, this could be one of the things that you need to kind of deal with. It's like dealing with the root causes of your emotions. So the new thought pattern, I balance my masculine energy easily and effortlessly. So if you don't feel it at the time, this is something you're working towards. On the left side, it's the opposite. So you have difficulty maybe receiving things or taking things in. You might be considered stubborn. This is the feminine energy, and relates to the mother. Same thing, maybe you don't have a good relationship with your mother. The new thought pattern, my feminine energy is beautifully balanced. with respect to inflammation, the probable cause is fear, seeing red, inflamed thinking, anger, and frustration about things you're looking at in life. So the idea is, sorry, the video is kind of in front of it, but the idea is to be more positive and looking forward more to what's coming in life rather than fearing it. Okay, so that's the end of my presentation. I hope you've learned a little bit about how you can reduce inflammation. And I hope you learned a lot about what Garnet said about his educating us about hip health. You can contact Garnet. If you're in Toronto, there's his address. His website is www.moaliving.com. There's his phone number and his Instagram. Make sure you follow him. And also his email address if you have any questions. For me, I'm the IFMA Athletes Commission Chair. We have a Facebook and also Instagram. Please visit us because we have lots of information for Muay Thai athletes. If you have any specific questions, you can email me. And on the website, the IFMA website, we're going to be having an IFMA Athletes Commission page with educational webinars like this and other information there as well. So we're working on it. Garnet, is there anything else you wanted to add?
Well, the probably one, I was like, trying to, I don't know about you guys, but also same thing, I learned a lot from what you spoke about. And as you were talking about left side and right side, I'm like, oh, wait a second, my right side feels like it's a little bit tight. I'm like, I wonder if my masculine energy needs to be worked on a little bit more. And and the thing is, it's interesting at these times, obviously, because at least here in North America, like the concept behind being able to look at your body in that form was kind of not necessarily looked at as like, oh, that's not true, or it's not, but there is a relationship with regards to that. So just to kind of like at least put a bit of weight on what Janice is talking about for individuals out there that don't necessarily subscribe to this thought process, is that there is a correlation with regards to individuals. I used to work in a financial district in particular that had back pain and lower back pain. Oftentimes there was a bit of, actually a lot of correlation with back pain and something financial. So if you look at it from what Janice was mentioning in terms of like if you do have aches and pains on left side, right side, and so on and so forth, it goes back into, once again, how your body is essentially weighing in on that side. So if you look at it as a whole, if there's areas in your body that is either folded a lot of the times, you will end up kind of restricting that space. And other things in terms of what I've learned over the years, I do practice in terms of my own meditation and Qigong practice. In particular, in Eastern philosophy, there's a thought process in which it's like when you're sitting down for long periods of time, it's kind of going back to the hip here. It's almost seen as a waterfall in terms of the pelvis being kind of what holds the water, which is the basin, and your spine and your head kind of putting all the water into that space. Now, the issue with this is that the body is not a waterfall, it's an ocean. So you constantly want to get things moving a lot of the times. So if one area is restricted, if you have financial problems, and I don't mean to make this more financial problems, but you tend to basically be leaning forward, your head is down, that sign of like, you're not feeling that well, sick almost. But that can also get with the tissues around that space that ends up becoming matted. And that's why sometimes when we talk about, oh, my hip hurts or it's tight, I can't stretch it out. There's a part in that in which Janice was also trying to explain with regard to all of this in particular. But one thing I wanted to add in terms of this as well too is that I am in Toronto, but we are here in Toronto. We do a thing called virtual rehab or tele-rehab, in which like you can contact our therapists, our practitioners, our physiotherapists even, to basically do an online assessment in which we can actually go through a bespoke or kind of like tailor-made for that individual body to basically help you in these times, especially in which like a lot of these things are limited by touch, to at least guide you in terms of, okay, you should do this exercise and this exercise and this exercise. Similar to this, what we have is like FaceTime for rehab. So if you do have any questions in the next few days, for a few months or a few years, don't feel contact us, like what Janice has said, and we should be able to get back to you as soon as we can. And that's it for me, Janice. How about you?
That's it for me too. We do have questions, so there's one directed to you. Right? Do you have time to answer?
Sure.
Yeah, okay. This one is from Oscar Perez. He's the General Secretary of the Mexican Federation. He says, great presentation. I have two questions. One, if you want to assess strength and stability of a given muscle, would you add some isometric resistance when you test the movement?
Yes, isometric at the end ranges. So I'm just going to use my shoulder just for the sake of, just so you can visualize it. So isometric in terms of it has to be done by the other person. And what I would do in terms of this position itself, I'm just going into external rotation. So my shoulder is now turned out as much as I can. What I would do is basically on my side of it, I would just press slightly on it and let the client or the patient basically try to push into my hand. Now, what you, the person that is testing it, is trying to basically just gently push down that arm. It's not an arm wrestling thing with regards to it, but that's how you test if the muscle is weak. When something is flawed, it'll fall down. So check it out with regards to glute med that I was telling you about, in which if, I'm just going to use my fingers here, but think of the legs being like this and you're lying flat on your back. And essentially you're going to get the client or the patient or the athlete to kind of bring their leg out this way. And at the foot, you're pushing it towards the middle. So in terms of isometrics, you would do it afterwards. To activate natural muscle, you only need to basically push about 10% of your strength into that space, so you're essentially not moving it, for 6 seconds for 6 sets or 6 reps. So holding it enough is you're trying to, there's a science behind this as well, in which the ends of the muscle has these things called synapses that you're just trying to teach that nervous system to fire in this way. So yes, you would prescribe, or at least in a way kind of give the setting of, if you do find the weakness, all I gotta do is just kind of, if it's my shoulder that I couldn't move it this much before and I'm weak at it, I would just basically hold it for 6 seconds, 2, 3, 4, 5, and 6, and relax it, go back into it after 6 seconds, 1, 2, 3. You would do that for 6 times, and then you go into the motion when you're, especially when you're seeing weakness. And what you're trying to find in terms of, aside from your question for the first one, is that you want to see range of motion in terms of the body. You want to make sure that it is moving in the right plane. And if that person can't go as far as here, to me, it's a suspect. I would look into it, just make sure there's no pain happening into it if it's more weakness. And you'll find that everything from like, so if it was my shoulder, the way they're punching or they're turning their fist when they're punching gets a little bit stronger, or even push-ups are going to get a bit stronger, or just in general, like clinching in particular will also help with that. And just apply that to everything else. What's the second question, Jay?
Second question is, beside the side plank, which will be your go-to exercises with hip mobility focus right after waking up?
Good question. For hip mobility, I would be like, I can't show it on this one, unfortunately, but it will be on the floor. The side plank is good for just isometric. Once again, so I'm just neutralizing the spine. What I would do is go into a kind of a it's kind of a swastika kind of position, where in which like it's the angle is. Wish I could show you guys on the floor here a little bit, but I just don't have the access to it. But essentially, I'm just trying to externally rotate my hip outwards. Because a lot of the times external rotation is weak for a lot of people, just everyone in particular, if you're sitting for long periods of time. Maybe you could do it in another workshop, but essentially external rotation.
There's a whiteboard. Can you draw it or no?
I've never tried it, but let me try it. Yeah, for sure. Let me see.
Try it.
Oh, this is cool. All right. Let's see. So the shape of it, like just imagine if it's your hip, right? So
I can't see the whiteboard yet.
Let me see. Let me see. Draw over screen over presentation. Okay. Nope. That's not it. Oh, there it is. Okay. Can you guys see this in terms of the whiteboard right now? What I just drew.
And then
Okay.
you deleted it, right?
Yeah, I did. So the leg in terms of your hip, external rotation of the hip, basically, just imagine this part here is your head. And just trying to be, without being dyslexic here. This is going to be your hip at the front. And this is your feet. And this is going to be your hip at the back. So kind of in that position itself. So this is your head. So this is the aerial view here. And external rotation is basically just with this. This is going to be your knee. And this is at the floor, by the way, guys. I'm just going to be lifting my knee off the floor. My foot stays fixed on the ground. My pelvis, which is kind of here where the leg bone goes into, also stays fixed on the ground. So I'm just lifting this part up off the knee. And same thing, 6 seconds for 6 times is to at least get the mobility in the right hip here. And then you just switch on the other side. There's in this one, it's called external rotation. And you could do the same thing similar to that at the front here, doing the exact same concept, going on to internal rotation. So it's my go-to one in which I'm trying to release my hips, is to lift the knee off the floor, lift the knee off the floor. And then I would just switch it, just depending on like mobility. And what you'll find is that like if you're stiff, is that you won't go as far or as high up in terms of this leg and this one over here. So hopefully that gives you a little bit of an insight with regards to this. If anything else, maybe I'll link a video on our next topic.
Great,
It's a great one, right? So let me just get out of this.
Do you have time for one more question? Do you have to go?
Yes, I got one. Yeah, one last question.
Okay, so those who have back pain, are those moves helpful for them as well or not?
Yes, it does. So that one in particular, or is it the first one that I was showing with regards to lying flat on your back?
Mentioned in this presentation, he says.
Okay. The one where you're lying flat on your back, the gentleman that you guys saw with their feet elevated up, that will at least help with neutralizing the spine. So what ends up happening with regards to, for fighters, what I've seen a lot of the times is that like the lower spine gets jammed up a little bit. So imagine somebody doing a teep right into your stomach. So imagine how the spine kind of moves and shifts. So what ends up happening is that sometimes the spine itself can like move enough that these areas become irritated in the front. So imagine it's a kind of a front motion, right? So this is me, this is my spine in front of you, and you're pushing into it, and then you kind of push it backwards. But the thing is, with regard to the spine, it's resilient. There are ligaments and tendons that are holding things in place, but you can irritate it enough. So by lying flat on your back, so go to seek a professional when it is something in terms of having real sharp pain. You can definitely contact us if that's the case for you. That will start you off. So you want to neutralize the spine a little bit, and then you want to build up in terms of strengthening that area afterwards. With back pain, there's many factors that comes into play. So alignment is key. It could be a hip thing, it could be an ankle thing, it could be a knee thing, to be honest with you, with regards to back pain. And it could be an anatomy thing. So it really depends on your spine as well, too, on how it's built. We all have skeletons, but people are just built differently. Okay, your hips could be a little bit different from your spine. Like there's so many different I guess bodies out there that it really, the best answer is that it depends. But at least these are just general guidelines in terms of if you are experiencing back pain, and if it's something to do with your groin that's causing you back pain, then elevating your feet will help. Isometric exercises such as the side planks is essentially your first steps towards regaining your strength, because if you can't stabilize a particular area, then you don't have no shot at being able to run with it, jump with it, or kick with it. So going back to connecting this with Janice's presentation, the inflammation or anti-inflammation which in terms of food will also help with reducing a lot of the irritation in those spaces. So what you want to try to do is combine a lot of these things together: rehab and eating properly, especially if you're injured. Hydrating is a key one as well too, to just basically build up towards it. And like anything else, I know that as a fighter, you're often told to push through the pain. When it's an injury, when you feel in the joint or in the spaces, don't push through the pain. All you're doing is like you're shortening your career. Instead of being able to do this for years and years and years, you're only going to be doing it for 2 years. So your goal has to be set in stone, in place of like what type of athlete do you want to be, what type of fighter do you want to be, and not looking at this from like a one shot, one hit wonder type of thing. You want to look at this as a career. If you are honestly like dedicated and passionate about anything, in this case your sport, to look at this from the long term versus like, okay, I'm gonna do this. So you do want to invest the time in terms of making sure that your body is good. Like Janice mentioned earlier, in terms of meditating, I mean, meditating could come in different forms. Running to me is meditating. My thoughts are not all over the place, right? I could also meditate in terms of sitting in a lotus position and just listening to, Tibetan sounds or bowls. That's different. Praying is meditation. To me, meditation is just a matter of getting rid of these thoughts in your head, this monkey brain that is all over the place. Centralize your clear image or vision about what it is. Over the years, Janice and I have worked on a lot of things, including all of these factors. And I would say though, Janice's focus is just intense. When she wants something, she really she doubles down, she commits to it. She commits to everything that she does. And trust me, it wasn't easy for her. She's had a lot of things that we've had that she's had to deal with in terms of getting to where she's at right now. But she always had a vision and an image of where she needed to be. And to me, meditating and all these other factors just centers in on what you need, how in life. These tips, not hips, that we're giving you is there to just basically help, but it really is up to you to determine what you want to do in this lifetime, in this sport, in this field of yours. And I often reflect on the times when, in terms of being in the ring and so on and so forth. And to me, fighting is like life. There's times in which you'll be punched multiple times, and you just have to wait until it's your turn to punch back. Hopefully you don't get knocked out. But life is like being in the ring. It's oftentimes you have a problem, and you have to kind of face it, face the problem itself, don't run away from it. And you are going to get hurt, or you're going to be hurting the other person. It's not in terms of solution. So everything that you guys are doing right now, even though it is a little bit isolated in terms of the sport, hopefully you can reflect back into this in the macro kind of concept to realize that what you guys are doing right now as athletes could also progress into becoming great citizens. It's just a lot of the mental stuff that you guys are dealing with helps you in the long term to deal with any problem, similar to what we're all dealing with right now. There is going to be resiliency in terms of mindset throughout all of this stuff, and something great will come out of this. I know it doesn't seem like it now, but it will show how strong we are if you continue to progress towards your vision, your mindset, and so on and so forth. Even injuries, to be honest with you, you really want to and need to heal. It's up to you to basically, in a sense, like what Janice was kind of touching base on, of saying these mantras in terms of, I'm balanced. And it sounds silly if you think about it. If you're young enough to be listening to it, you're probably like, when I was young enough, I'm like, what are you talking about? But there's truth to that. You have to, in a sense, like believe in yourself first, because ultimately, like when you're in the ring, you're by yourself, right? The other person is coming at you. So the belief in yourself, in a sense, that your me time is also important through all of this. So all these factors come together to form you as a fighter, and what legacy you're willing to leave out there in terms of the pursuit of excellence in what you're trying to do. So anyways, long spiel there, but that's my answer to the second one.
So I call Garnet the mad scientist, and other people call him as well, because he has a really great outlook on different things. And so, like I said before, when you're looking for somebody who is going to help you, they just, for me, it's like really, it's a bigger bonus when like they're not only helping the physical pain that you're encountering, but like they make you feel a ton better because emotionally they're there for you and they're behind you and they're there to listen. So that's what Garnet does for me and has done for me for over 10 years. So that's the kind of the relationship that we have as the therapist and the athlete. So I really
I
hope
just want to make a comment on. Well, I just want to make a comment on the mad scientist thing. That's why she made me do the whiteboard thing, I think, on purpose. The reason being, so I just want to. I get called the mad scientist in the Thai boxing industry all the time, and people don't really know the reference of it. It's not because I'm wearing these glasses, and I used to be a lab technician for a few times in my life, and I used to wear a lab coat and everything else. But when I am actually going through ranges of motion for somebody, like I literally have a whiteboard, and I'm looking at, I'm like, okay, this person's femur or their leg bone or their hip bone, and I'll write it down just so that I don't forget. Because like as you're going through the art in like manual therapy, because it is an art form, at least what I always looked at this, not just a technique, it's an art form. Like what you guys should, at least in terms of Thai boxing, to me, it's an art form. Is that like I know that my brain can't like remember everything. So I'll write things down like as if I'm doing some sort of equation, and then I'm like, okay, I did that one, I did this one, I did this one. So it's kind of a bit like checklist for me. So when these guys are getting treatments, they're hearing like so. Anyway, that's a reference to the mad scientist thing. I'm not a mad scientist, all right? But yeah, thanks, Janice, for having this, and really had fun with this.
Thank you, everybody, for attending. We're so happy that you're here. We wanted to give you this webinar so that you can have the tools to make more informed decisions. And like Garnet had mentioned, we want you to be responsible for your body. Every body is different, and not everybody responds to particular things the same. So we want to give you the education and the tools to make sure that you're healthy throughout your entire career. There is a poll at the end. I hope you fill it out because it'll give us a little bit more information on what we can target. And it'd be great, and we appreciate that if you fill that out. We're going to have a webinar every 2 weeks, same time, same day, so Wednesday at 8 p.m. in Bangkok time, and for Garnet, it's in Toronto, 9 a.m. in Toronto. And also there will be a replay. So if you have friends that weren't able to make it, there will be a replay video, and there is a really cool option to ask your questions during the video. And we will get to those questions as soon as we can. Again, and if you have any personal questions for either Garnet or myself, please email us or contact us on Instagram or whatever. But all the information is there.
Sure.
So thank you guys, and thank you, Garnet. That was a really great presentation about the hip.
Have a great one, guys, and have a great one, guys. Continue pursuing excellence, all right, guys. And anything, we're here. We're not just practitioners of health. We've been there, been there, done that in terms, at least in terms of training. So we know what it's like to grind it out as much as you guys all do. We understand the struggle. We understand the pain, discomfort through all this stuff. But like everything else in life, like the more you work at yourself, the better you realize what you really made out of. And isn't in this life, it's not about being right. It's about getting things right. So hopefully you get it right.
Okay, stay safe, everybody. Sawadee.
Thank you, guys. Peace out.
Bye.
Bye, guys.